than Harvard.
Directly ahead, Dr. Marc Lamont Hill, another brilliant man, has a different view of the president's press conference tonight. And later, here now, Dr. Marc Lamont Hill, an Obama supporter and Fox News analyst. Okay, now you get my point here, I'm sure, that even people who are in the business, who have education, don't know what he's talking about.
Well, people in the business may have been looking for something different than what he was willing to offer tonight.
I wasn't looking for anything.
Yes, you were.
No, I just want to know what he wants to do.
No, well, he said what he was going to do, but what you were looking for were specifics. You were looking for.
That's what. When you're going to do something, specifics tells you what you're going to do.
No, I'm with you. I agree. I was looking for numbers. I was looking for specifics about where the money was coming from.
Right.
That's not what he intended to do today. I think part of what he was doing was responding to the broader public discourse. There's a lot of fear-mongering going on, as he said, from Republicans trying to say that this was going to crumble the American economy.
You think that reassured anybody?
Oh, absolutely. The first thing he did when he comes out, this is what he does when he comes out, right?
Yeah.
He says, look, many people are saying that we can't invest in healthcare right now because we have a crumbling economy. He's saying these are not competing claims. In order to save and stabilize the economy, we must reform healthcare. That's a big deal.
No, but here's the deal. If you like Barack Obama and believe in him, you'll believe him. If you don't like him and don't believe him, you're not going to believe him, like Morris. However, most people are in the middle. They can be persuaded one way or the other. He didn't persuade. I guarantee you that the polls that come out tomorrow and Friday are going to drive his numbers even further down.
So.
Now, do I get that tie if I'm right?
You can have it if you're right. You're not going to be right. You know what I mean?
Well, he's 55% now. Americans don't like his health care approach, according to Gallup this week. That's a huge reversal. Now, I'm telling you, after tonight, it's going to high 50s, maybe 60.
Those same polls will say that 70% of Americans, somewhere actually 72% of Americans also favor a public option. They also favor reform.
And they do.
So
they want it, but not the way Barack Obama is delivering it to them because they don't understand it.
Now, here's where we agree. He should have given more specifics. I wanted to know where the money was coming from.
Sure.
I was happy to know it's coming from you and not me because it's going from the wealthiest 3 or 4%. That makes me feel much better. But he didn't get into specifics about how that was going to happen. What he did say, though, is that 2/3 of it is already in the system. That assures American people that this isn't some sort of scavenger hunt for money. That's a big deal.
See, look, I don't know why you're being so naive. That's what he says. What he says and what's true, you know what politicians, I'm not saying he's consciously lying. I'm saying he's spinning it.
I don't think he's spinning that.
No, I know you don't because you like him.
He's spinning the congressional stuff. He's making it seem as if there's a problem, it's coming from the right. If there's a problem right now, it's coming from Democrats.
Let me ask you this. It worries me that my medical history and your medical history is now going to be on a disc in Washington, D.C., rather than the confidentiality of a doctor-patient, which we have had in this country for decades.
Absolutely.
That's gone.
That's not necessarily true.
Yeah, it is.
No,
that's on a disc in D.C.
No. Obama didn't say that. In fact, that's one of the big myths, though, is that somehow the government's going to intrude upon the patient-doctor relationship. That's not necessarily true.
No. Let's just stay with the data.
I'm talking about with regard to data.
The data is going to go to a bank in Washington, D.C. It has to.
You're talking about in terms of the sort of bureaucratic process.
No, I'm talking about you, Dr. Marc Lamont Hill, having a condition, whatever the condition is. Now your physician knows it, and the physician tries to heal you.
It seems appropriate.
Oh, yeah, that's what it's been,
right?
And that's the way it should be. Patient-doctor confidentiality. With his program, that's gone. It goes to D.C., and the bureaucracy decides how to treat you, not your physician. Doesn't that worry you?
It doesn't worry me at all. See, once again, you have a private option, you have a public option. If these things don't work, then it shifts the other way. That was Obama's point. Competition and market-based solutions work.
So you don't mind having your condition, whatever it may be, leave your doctor's office and go to D.C.
and be part of a healthcare system. It's not going to Congress. It's going to a healthcare system.
It's going to a data bank that can be accessed. Okay, if you don't mind it, I do. And that's a big concern of mine. We don't have any privacy as it is in this country.
Well,
and now
it's partly because of the rights intrusion, but there's a bigger issue. There's a bigger issue here, Bill, than the privacy of your individual medical records. There's 50 million almost uninsured Americans. What are we going to do about them? Obama addressed that tonight, and that's what I think.
No, he didn't. He just said he's going to put 48 of them on the rolls. He didn't say how. He didn't say where they're going to go. He didn't say whether it's going to be clinics, whether they're going to have their own doctors. He didn't say any of that.
And part of that, and I wish he had said that, and I also wish I wish the press corps had pushed him hard. No, we're in agreement. It's okay. We can agree sometime. We're saying the same thing. He didn't give specifics.
He gets an hour of prime time. He goes on and bloviates in general terms, which he's done 15 other times.
He didn't bloviate in general terms.
When is it going to be?
He gave far more specific information ever before.
When are you going to start challenging the president
I think we are.
his job and to tell the American people, here's what it is, here's what's going to happen, here's what's going to pay for it.
He did that, though. He said that his preferred option was to have that other third come from the wealthiest Americans. He's saying, though, that that's not a popular option in Congress. He's letting them debate this out. He's not coming in and trying to ramrod something through the Congress.
There got to be numbers
you have to respect that.
Got to be numbers on the chart. Okay, final question for you. You have a system now that's chaos, the current system, all right? And I'm with you. We need to overhaul the system.
Absolutely.
I want to do it through private savings accounts and strict government oversight with a clinic safety net for the poor. Wow. That's what I want to do.
Oh my God.
I can make that work.
Welcome to the left.
I can make that work, okay? With not a lot of money, with cutting out corruption, I can make that system work. Now, that's my plan. My plan is better than his
That's
plan.
what Obama just talked about, Bill. He talked about efficiency, oversight, regulation, all the things that are supposed that you just articulated.
He doesn't want private savings accounts for health. He doesn't. I didn't hear any of the clinics. He wants to give the money directly to the people, the insurance. That has ruined the state of Massachusetts. It has ruined it. They're collapsing up there. So all I'm going is on available data. I'll give you the last word.
If you look at developed nations around the world, universal, or not universal, but this type of healthcare reform has led to efficiency, decreased spending, and better healthcare for everybody.
And I said I'd give you the last word. I lied.
I knew you. It's okay.
There is nobody going to Canada to try to get on their medical rolls from the United States. Nobody. The care is better and quicker.
Tell that to the 50 million people who don't have any coverage.
Okay. Marc Lamont, everybody. I'm going to get that tie. Plenty more ahead as the factor moves along this evening.